I'd like to invite, just before morning tea, Petrina Nettlefold to speak to you. Petrina's from the Department of Health and Human Services here in Tasmania, and she just wanted to make a couple of comments about peer work, please.
Morning everybody, and thank you for squeezing us into your agenda. My name is Petrina Nettlefold and I'm a Project Officer with the Mental Health, Alcohol and Drug Directorate. And Lucy Lester is joining me here today as a member of our working group. And one of the projects that I'm currently overseeing is the development of a peer workforce framework for mental health Tasmanian state public mental health services. So it's kind of a new ballgame. We're a little bit on the catching up side of things, and we recognise that the community sector has been working in this area for a number of years. Obviously, through the rethink process and consultations, this was a key strategy that was identified by all our stakeholder groups. So that includes the clinicians, service providers, consumers, carers and their families. And we're really excited that this framework, as it stands, will hopefully be finalised by the 30th of June. And then, of course, the hard work starts in terms of implementing that and getting our peer workforce into mental health services. So really what I wanted to do was just let you know that this work was happening and let you know that we really do recognise the value of a peer workforce and what that can potentially bring to Tasmanian mental health services and for people in the system and exiting the system and supporting them through that process. And also there's a range of consultations that are going on at the moment. Because of our timelines, it's a little bit short, but I am going to be talking to the Flourish Regional Advisory Group in the northwest, hopefully on Monday, and in the north on Tuesday. And of course, I guess I'm going to be around during the break, so I'd be really interested if you have any thoughts or comments or concerns or questions about it to just come up and have a chat to me. We're really keen to try and make sure that we capture the whole range of what this means for Tasmania in the Tasmanian context, because our situation is a little bit different to some of the other jurisdictions that have advanced this work. And I'm going to hand over to Lucy, who's who's our consumer representative on the working group and has been involved in this work for a while, to just give you her perspective on, why we're doing it and why we continue to keep trying to make it happen.
I worked on the initial rethink plan and was lucky enough to be asked to participate in the peer workforce development, which is really good because I also help out with the RTO Connect with the students doing the Cert 4 in peer mental health. And I guess one of the reasons, Petrina sort of said to me, so, what is it, why do you do peer work and why do you volunteer your time and your energy towards these projects? And I think for me, looking right back to my first psychiatric hospitalisation, which wasn't my first hospitalisation, I had that moment where I was sitting on my bed and I just went, well, it's finally come to pass. I knew there was something wrong with me my whole life because I'd always heard voices and remembered right back to the age of 3 that I could do so. And I knew that that wasn't what most people were doing. And so the day came and I just sat on that bed and I was heartbroken and I had no family or anybody and I just let it all hang out, and then after that I just went, you know what, I am going to meet as many people in this hospital as I can. I'm going to ask them and I'm going to learn as much as I can from anyone who'll talk to me. If they don't want to talk to me, good, that's fine, because I'm a patient and they are too, and I've got to respect that. And I spoke to absolutely everybody in that hospital, and every single person was a beautiful, beautiful spirit who'd had terrible things happen to them. And during that time, people spoke to me and said things that they said, do you know what, I've never spoken that to another soul. Thank you. And the nursing staff said to me, you really need to be working in one of these facilities. But I couldn't be a nurse because I can't stand the sight of blood. So that pathway wasn't an option, and that was in 1991. I've worked as a peer worker in outreach with Anglicare. I've worked with Flourish and DHHS in a number of roles, which is just as in a reimbursement for time thing, unpaid work. And I'm finding that I like to be hands-on. I'm a vocational person. I want to apply what I'm doing straight away. But the more I do, the more I realise there's a whole lot on the upper level. And even though I've never heard of things called white papers and things like that everybody around helps. And it's an opportunity to make change, and so that's why it's so important that we're doing this work. So Petrina does have to leave a bit early. I will be around for the day, and you can also feed back to me.